not have very good, another word, it does not include redox and free radicals and
Okay.
understanding peroxynitrate. In fact, he doesn't even damn the peroxynitrate. He doesn't consider it as a toxic. And
Yeah, it's interesting.
that's
Interesting.
where Nathan and I, we have a little bit difference in that part. But otherwise, he's a very genius, very smart doctor. I like everything about him, and especially with, he's very focusing on nitric oxide. But you need to think outside the box, and not just nitric oxide. You have to think about other things that surround the nitric oxide. That's the difference between clinician and a PhD. And in the lab, he used McCarran Blvd to inhibit the effect of nitric oxide. That's true. But in vivo, the McCarran Blvd proven to help, especially in low dose in the endothelial function test, because it clears those free radicals.
No, no,
And it does not really inhibit the endothelial nitric oxide synthase significantly, but it does help the inducible isoform, yes, the one that microphage is producing and leading to inflammation, which turns into peroxynitrate.
Well, what do you think then of his product, the Neo Forte? Which he spoke
I
on
think they are good. I mean,
I think
he's putting nitric oxide.
Right.
He's put, you know what he's put? He does not, the nitric oxide is nitrate, a chemical nitrates, potassium, and then he takes the vitamin C and they react together and generate nitric oxide. So it's not, is not, he's again is giving arginine because he said the enzymes of nitric oxide synthase are not enough when you grow in age. So he said, no, we have to give nitric oxide ready. So he put nitrate with vitamin C, nitrate potassium with vitamin C, and they react. They reduce the nitrates, and the nitric oxide will be released. And so that's a good thing.
So that's the preventive peroxynitrate then, or the vitamin C.
Yes, but so that's what you need to add in his supplement.
Interesting.
He's already adding antioxidant to clear up the free radicals. So the nitric oxide does the good thing.
Right. Interesting.
Right. So, but that's the where so McCarran Blvd helps to clear the free radical part, helps improve the mitochondria and all that. And it's with that dose that we're using, it's not significantly inhibit the good nitric oxide. In fact, it will help to increase it because you're blocking the nitric oxide from turning into peroxynitrates. And that's actually recycling the peroxynitrate back to the nitric oxide with McCarran Blvd. So we are good. I mean, the McCarran Blvd also turned the peroxynitrates into nitric oxide. And the inhibition of nitric oxide synthase is not that significant, especially for the endothelial part. There's isoform, there's inducible endothelium, and there's sinus nitric oxide synthase. So there's many forms of those synthase of nitric oxide. But I did respond to his article in my group.
Yeah, right.
So do we have enough number? Can you give me just 1 minute here? Be back.
Okay. Okay.
Okay. So I do recommend when you take McCarran Blvd, you take also nitric oxide. That would be good too. And the nitric oxide that you're going to take is completely, in other words, the McCarran Blvd will make sure that they will not turn into peroxynitrates. And McCarran Blvd in a reduced form, and there's oxidized form. In reduced form, they turn into white, like water. They lose their color. And that's the reduced form of it. And they help to reduce the hemoglobins, the ferric to ferrous. And then the hemoglobin itself, it turns the peroxynitrates and reduce it to nitric oxide. So McCarran Blvd directly and directly to turn the peroxynitrate back to nitric oxide and recycle them. So it's a good thing. So let's go back to the topic today. I think we're ready, right, Joe? You want to start?
Sounds good. Definitely.
Okay, so let's start with today. Today we're going to talk about this bacteria, Bifidobacterium, and it's one of the gut microbiome, good ones that we need to have enough of them in our gut because they produce a lot of postbiotics, which one of them are butyric acids. And the butyric acid will do the good stuff. You know, they help in stimulating the formation of the tight junction in the gut epithelium. They help to inhibit the inflammation, the Th17 in the gut. So it helps to keep the gut epithelium intact and prevent the leaky gut. Also, it helps to kill all those bad gut bugs, like Staphylococcus and all the bad bugs that are trying to get into your body. And also, butyric acid helps to kill cancer, colon cancer. So the bacteria in our gut, it's just they are not just bacteria there for no reason. They are gut bacteria that has synergy with our body and helping and producing chemicals, therapeutic chemicals that helps in our health, in buffering the redox, in restoring the immune balance, and killing the cancer, right, as anti-cancer. We know it also produces vitamin K, kills, it also digests the fibers. So there's many things that the gut bacteria does. And the most important part and function is to keep the gut epithelium, prevent the gut epithelium from leaking toxins. And we do that by, we need three things, in fact. We need to make sure the inflammation is not overactive in the gut. So we need things that helps to kind of put the inflammation down of the gut, because overinflammation, too much of Th17, too much of neutrophils can cause damage to the gut epithelium. And Bifidobacterium secretes butyric acid, which is anti-inflammatory, helps to keep the inflammation to the normal level. And we still need inflammation, and we need the immune to kill the bad bugs from getting into your body. So you don't want to suppress the immune system all the way down, but you need to keep it from being overactive. And that's the reason there's even a lab, I think it was here, talking about avoiding food that is overreacting, that the immune system is overreacting to them. Because this overreaction and overinflammation can cause too much of neutrophil, and that would eat up your gut epithelium and causing leaky gut. So that's one part. And this bacteria, this Bifidobacterium secretes butyric acid to keep the inflammation down. Of course, you need to add vitamin D, very important, vitamin D, because vitamin D also helps to keep the inflammation down from the gut. It inhibits the Th17 inflammation and being overactive. And then you also make sure you're taking vitamin A, carotenoids, because you need to have the epithelium of the gut mature. And that's the reason if you go to A4M, there's a scanner there that you put your hands in, you know those scanners, and they check your carotenoids. The problem, the company does not know the benefit of it to explain it to the doctor. That's piece of a device. It's very critical, it's very important. But the company, they don't know how to present it to the doctors, except telling them that you're going to make money and they have a pyramids, whatever. That's what they are selling it based on revenue versus understanding the benefit of it. It is very important that you need to make sure your carotenoids level is normal. And that scanner will tell you immediately whether you have low carotenoid level or high. Because we have carotenoids in our skin, and there's a blue light that's come from the scanner that helps to detect the level of carotenoids. And if you're low carotenoids, what's that mean? That means all your epithelium of your body is not mature. Think about it. Your gut epithelium is not mature. Your endothelium that lines the blood vessels is not mature. Your skin epithelium is not mature. And then what does that mean? That's mean you will have endothelial dysfunction, okay, which can progress into hypertension and atherosclerosis. That's mean you will have leaky gut syndrome, right? Because the gut epithelium is not mature enough and they don't form tight junctions. And that's mean you have problem with absorption of nutrition. So you have malabsorption. So you cannot give patient nutrition and advice on nutrition and his carotenoids are low. Because whatever you're giving him, he will not absorb it. And that's the reason a lot of you here, you're taking vitamin D orally, but you still the level of vitamin D is not getting there. And if the doctor, the patient, even your patients, you say, I'm taking my vitamin D, but when you check it's low. And I'm exposing to the sun and all that, still it's not enough. And the reason is that he may have carotenoid deficiency, vitamin A, and that leads to immature gut epithelium, and that leads to the malabsorption. Yes, you're taking vitamin D enough, but you're not absorbing it because you have carotenoid deficiency. And so we need to make sure that the patient is taking carotenoids and vitamin D, and how you can take it in one dose. In other words, naturally have vitamin D and A at the same natural substance or nutrition. What is that? Cod liver oil. Cod liver oil, and I promote it a lot because it is an oil that has both vitamin A and vitamin D. So that's a good thing. And so I don't like to give vitamin D by itself, because if I give it and you don't have enough vitamin A, then you'll have malabsorption. So take cod liver oil. And then you need to make sure your bacteria are in the gut. They are right bacteria with the right numbers and the normal varieties of the bacteria of the gut. And one of them, which is a good one, is Bifidobacterium. And the Bifidobacteria, it happened that it feeds from the ivermectin. So ivermectin now, it's a prebiotic. And ivermectin is not man-made chemical. It's produced by a bacteria called Streptomyces. Even Dr. Corey and all those people were talking about ivermectin. They don't talk about it as it's a natural product. They talk about it as a big pharma product. And that itself will change a lot in the feeling, even the big pharma, the mainstream medicine doctors, not the big pharma. Big pharma, they don't want it. They don't want to have supplement to compete with the man-made pharmaceutical big pharma product. But at least the mainstream medicine, when they recognize that ivermectin is produced by a bacteria as a postbiotic, anything that produces bacteria, we can consider as postbiotic. And the Streptomyces species, and we do have Streptomyces in our gut, but the Streptomyces, this kind of Streptomyces, we don't have it in our gut, by the way. And it's called Streptomyces ivermectis. That's where ivermectin came from. We don't have it in our gut, and it's in the soil. That's true. But there is manufacturer who create probiotics, but not for human, for shrimp. Okay, to kill the parasites, using Streptomyces ivermectis. Now, can we make Streptomyces ivermectis for human? I don't know. I didn't see any probiotic has Streptomyces ivermectis. But we find out that Bifidobacterium and Streptomyces species, they are the same family, same phylum. So, and they are synergistically, they work together. They're not antagonizing each other. They feed each other. So Streptomyces species, when they produce ivermectin, ivermectin is not a toxic to Bifidobacteria. It's actually a food for Bifidobacteria. So you can grow them together. We have Bifidobacteria in our gut, yes. And we have Streptomyces species, but not the ivermectis ones. Now, the question is that, can we create probiotic Streptomyces ivermectis in our gut? I don't know. And that's where we have here a pharmacist named Dr. Hotan. I mean, he's selling Bifidobacterium as a probiotic, which mediate the action of ivermectin. We're going to talk about it. But the question is that can we have Streptomyces ivermectis that produce ivermectin in our gut? So that's something pharmacists and manufacturers, because I don't know, maybe the ivermectin, too much of it is not good. I don't know. So, I don't know why. But what I know is that this bacteria, Bifidobacteria, feeds from the ivermectis, from the Streptomyces ivermectis product, which is ivermectin, and it helps our Bifidobacteria to grow in your gut and populate, which is good because you need to populate those good bacteria and produce butyric acid that gives you all the good stuff, that kills the bad bugs, that kills the cancer cells, that decreases the inflammation, that keeps or maintain the leaky gut. And we find out that people who have low bifidobacterium level in their gut, right, they are more susceptible to COVID. So it seems like this bifidobacteria mediate the ivermectin in protecting us against the inflammation and the cytokine storm of the COVID. So people who have low level of bifidobacteria, they have high risk of having the COVID-19 storm. And the people with enough of bifidobacterium in their gut, they don't get sick, or they don't have that high risk of getting sick from the COVID. So that's a good thing. And they made the study and they find that people who have low bifidobacteria, they are the people who are in the hospital and suffering from COVID inflammation, cytokine storm. And the reason why, because bifidobacterium secretes those butyric acid and those other things that helps to calm down the inflammation of the COVID. And we know that mainly the inflammation of the COVID is Th17 and interleukin 6, and so bifidobacteria secretes chemicals that helps to calm down or suppress those overactive or the storm of COVID. Okay, and also we find out that bifidobacteria, they are low in those people with who are susceptible to COVID. They're also low in people with obesity and people with autoimmune diseases. And so that's mean if we increase the level of this bacteria for patient or for a person with obese, it may help it may help in managing their obesity. So it seems like this obesity and fat, the reason why people have difficult for burning their fat, and it's because one of the reasons is because of inflammation and interleukin 6. Fat itself produces interleukin 6, and they become resistant to be burned, or they become resistant to lipolysis and beta oxidation and burning the fat. Those enzymes, they get blocked from the inflammation. And so if you have enough of bifidobacteria in those obese patients, and the bifidobacterium produce all this anti-inflammatory cytokine, including butyric acid, it may help to decrease inflammation and make those fat cells to be responsive and start burning, or having that ability to burn the fat and shrink. And so that's the reason we find out that obese patients, they have low bifidobacterium. And so we think that if we can supply them with bifidobacterium, we may help in decreasing the inflammation in the body and help to shrink those fat cells and make the patient lose weight.
Hey,
and
Dr.
that's
Halasa,
one of the things that we're adding it to. Yes.
Just wondering if you're advancing slides or if you're still on the same slide.
Yeah, I'm still on the same slide. I'm more or less
Okay.
trying to come up with
checking.
a summary of what we're going to talk about, and then we can go through the slides. And then also old age, people with old age, and I think elderly people are also having high risk of COVID. The reason because they have low bifidobacterium. So that may help. So instead of giving all those vaccine, we may think that we may give them something that even better, which is supply them with enough of bifidobacterium. And that may help to prevent those patients from, or prevent COVID-19 from becoming, from the cytokine storm and all the super inflammation, and give that protection for the patient from the inflammation and the cytokine storm of the COVID. So it can be used as a prevention. So right now there's buzz that there's a new strain and there's COVID and all that stuff. Okay, but I think the strain that even we have it now, it's not that as we have it in the earlier time when COVID had happened. I think we can just go ahead and give them enough of vitamin D and enough of Bifidobacterium and in the form of cod liver oil. Maybe this would help them to completely fight the infection without any symptoms. So instead of and get the infection, the new strain naturally infected, and get the immune system that we need, especially for healthy patients. And so this maybe helps us in optimizing health, help us to reduce the patient's weight. So it's good for the obesity, because we know the obese and diabetic are high risk of cytokine storm of the COVID-19. So optimizing the health by giving them Bifidobacterium probiotic along with cod liver oil. Those two things will be enough to keeps us healthy and fight any of those flu and viral infection. And the reason why flu is high during winter, one of the reasons of those viral infections, they get worse in the winter, because we have low vitamin D. And the reason we low vitamin D, because there's not much sun that we go out because of the winter. And that's the reason. So if we, recommend cod liver oil during the winter, along with Bifidobacterium, we can have enough immunity to deal with all those viruses, whether it's flu or COVID, whatever, corona, and pass the season without much of problems.
Halasa, what is the reason why the old people don't have enough Bifidobacterium?
Well, I think it just happened that those Bifidobacteria, maybe they don't.
We don't have an answer, right? Okay.
What is that?
I said you don't have a right answer, right?
No, I'm just saying. Yeah. I mean, it's like any other deficiency, right? I think the nutrition that we're taking, I think it has to do a lot with the aging process and the food that we are eating, possibly. But if when we grow in age, we need more of those things versus the young people.
Dr. Halasa?
Yes.
I think you hit it right on the nose there with that. It's usually the aged people who have had poor diet, and Dr. Patel, you know as much about diet as anybody.
But I think there are old people who are on a good diet, good thing. So if you say old age generic way, then it's not necessary. The old people are taking better care of themselves, but there are two groups of old people, and nowadays we don't know what we call it old age.
No, but one thing we have to keep in mind is that our foods are devoid of nutrients for the most part, so these people need supplements as much or more than anybody does.
Now, I have a feeling that I mean, of course, the chemicals are there, but then chemicals are there for all age groups, not just the old age group.
Yeah,
the immunoglobulin in the gut and the gut health may have been reduced, which is the age dependent, and then they don't have as many stem cells, so their proliferative capacity and other things are not there, and then they don't have a good amount of immunoglobulin in the gut to support.
Exactly. It's a cascade of issues.
It's not old age by itself, but there are contributing factors to itself.
Yeah, I agree. There's comorbidities, there's so many other factors. Plus, many people abused themselves when they were younger, and they might not recover as fast.
I mean, there's many factors, as why the young people, they have healthy microbiome, but when you grow in age, your microbiome get disturbed. In other words, you get all this pathological bacteria start populating in their guts instead of the healthy ones. And I think you did answer yourself there. Part of it, the immune system, when you grow up, they don't get, in other words, they get disturbed also and imbalanced, and you don't have enough of immune system to fight those bad bugs. So the bad bugs are not just being fought by your good bacteria, but also your immune system. And maybe with age, the immune system is not fighting those bad bugs, and they populate and kill the good bugs and take over the good bugs. So that's a good explanation. I think you did. That's what I learned from you. And that's maybe the reason. Plus, with age, we have oxidative stress and all that. So we need to really make sure that those old people, elderly people, they have enough of nutrition to go against the aging process. Because as we grow in age, everything get disturbed. Everything gets imbalanced. The immune system, the redox, your metabolism.
No,
You
you're
have
right.
less of nitric oxide
I was
produced.
just wondering about it. And there's number 2 is the newborn baby and the young babies who are breastfed on the breast milk. They have a large amount of bifidobacteria in their gut and in their stool. So it just tells you that what are the promoting factor in the breast milk, that there is so much of the bifidobacteria as compared to the other bacilli, lactobacilli.
I think the immune system
It is the mother's milk, which is very rich in immunoglobulin.
Right.
And of course, there are other factors like lactoferrin and other things which helps to support the growth. And baby is not on glyphosate containing food and etc. But they get a lot of chemicals from their mothers, so it's not like they are completely free of chemicals. But I just want to make sure that we understand. We just don't say old age by itself. We have to understand that what is the dynamics of the old age. And similarly, the autoimmune disorders.
Isn't it?
Yeah,
true
I think
there are different
anything that
species,
causes
though?
immune disturbance, you will have growth of the bad bugs versus the good bugs. And the breastfeeding milk doesn't have enough of immunoglobulins that may help to kill those bad bugs, to allow those good bugs to grow and take over. It's a fight between good and bad. And I think your immune system, healthy immune system, is very important, along with the good bacteria to fight the bad bugs. And if you don't have a not good immune system, you cannot rely just on your good bugs to fight the bad bugs. You really need to have these 2 weapons. And I think with age, the immune system gets a little bit disturbed or imbalanced, and so you lose that fight, and those good bacteria, they get shrinked and overcome by the bad bugs. That's what I think. Yeah, I think that's a good answer. So I think we understand the whole lecture of today. I mean, I'm trying to summarize it here. So what is ivermectin? Ivermectin is an antiparasitic agent that has gained attention as a potential COVID-19 therapeutic. It's a compound of the type of ivermectin, which is fermented product of Streptomyces ivermectis. Ivermectin. So that's the bacteria that produce the ivermectin, and then this ivermectin that we are taking, part of it helps to increase the population of the Bifidobacterium and feed them as a prebiotic. But also the ivermectin has direct effect on COVID. We know it blocks the spike protein, and it does inhibit directly the Th17 inflammation. So it has an anti-inflammatory and antiviral effect, in addition to help to make this bacteria to grow, which is a Bifidobacterium. And so the ivermectin, as a byproduct of Streptomyces fermentation, is capable of feeding Bifidobacterium, thereby possibly preventing against the COVID-19. So the action of ivermectin, mechanism of action, one way, because not all the way, is by feeding as a prebiotic Bifidobacterium, increasing its population, and then in the gut, which is a good bacterium that produce postbiotics, the butyric acid for one of them, and that butyric acid helps to decrease the inflammation and have the Th17 inflammation. And also Bifidobacterium itself helps to combine with the inflammatory cytokines and neutralize them by the bacteria itself in the gut, and you get rid from those inflammatory cytokines. I think it's a tumor necrotic factor, but we're going to see that in the coming slides. Okay, so Bifidobacterium may be capable to boosting natural immunity, balancing the natural immunity, I think is the better word, balancing it, offering more COVID-19 protection. So that's me, and then I think this explains how one way of the mechanism of action of ivermectin protecting us against the cytokine storm of the COVID. So the SARS-CoV infection has been globally pandemic, affecting the world for the last 2 years. I think we recognize that. Symptoms include fever, cough, shortness of breath, GI issues, potential pneumonia, blood clotting, and multisystemic inflammatory complications. It would be good if we start the treatment early in a state of waiting patients to get into the stage of hypoxia and where it's just hard to reverse them back. So that's one of the things that leads to millions of people to die because of the wrong recommendation that we have when we had the COVID in the beginning. Current treatment for SARS-CoV include all this. This is the big pharma products. Remdesivir, it's an antiviral drug. Proven is not that much effective. Paxlovid and hydroxychloroquine. Hydroxychloroquine, the mainstream medicine, big pharma, they don't like it, although it's helps in reducing the Th17 inflammation. They say it's an anti-malaria. Yes, it's anti-malaria, but also it's being used for treating systemic lupus erythematosus. And what's the commonality between systemic lupus and COVID inflammation? Both are Th17 inflammation. And so there's many drugs that's being used to manage COVID. Among that is ivermectin, although ivermectin is not being recognized by the mainstream medicine. And the reason, because ivermectin in their eyes is just an antiparasite, but they don't recognize ivermectin as an anti-inflammatory. Although we are using it, and the big pharma mainstream medicine are using it as an FDA approved to manage rosacea, right? And what's the mechanism of ivermectin for rosacea? It's because of its anti-inflammatory effect inhibiting the Th17 inflammation. And because, yes, it does have antiparasitic, and we think that rosacea is being triggered by mites of the skin. But it's not just that. It's also because of its anti-inflammatory effect. Dr. Fauci and Dr. Hotes and all that, they don't recognize the anti-inflammatory effect of ivermectin. They don't want to recognize, or out of ignorance, or out of, I don't know. But it's like tetracycline are anti-inflammatory and antibiotic. Ivermectin is anti-inflammatory and antibiotic. The mainstream medicine, they don't want to recognize it as an anti-inflammatory. I don't know why. But ivermectin is not just anti-inflammatory, and it is not just antiparasitic, but also it's antiviral as well, especially for COVID, because it combines with the spike protein and preventing spike protein from attaching the ACE2. Vaccine has been distributed widely, and we know that, and mass introduction of vaccine and vaccinating everybody, healthy and unhealthy kids. And I think that was a mistake. I think needs to be selective if they want to do the vaccine, and not for population where they have already enough of immune to fight the natural infection, especially the kids. Recent mutation has been making coronavirus infection, as we know, changing, and then when they change, your immune system needs to be updated. And so the mainstream medicine think the way that they can be updated is just creating vaccine for them. And you would end up having every 6 months, every 3 months, the new vaccines and multiple vaccines being injected into our bodies. And that vaccine produces spike protein. We know the spike protein itself is pathogenic, and leads to all this problem that we have, which is the spikopathy. I don't think it's the vaccine is being. I mean, I like vaccine. Don't take me wrong. It helps to make the immune system prepared to fight any germ. That's right. But the vaccine has to be non-toxic and not producing a toxic into the body. And also the vaccine has to produce a balanced immune system. And the vaccine of COVID does not produce balanced immune system. They produce more of Th17 and Th2 memories without much of Th1. And if you don't have the balanced immune system, then you cannot fight that virus effectively with imbalanced immune. You can fight the free viruses with your antibodies, that's Th17 and Th1 involved in making it, but you will not able to be clearing the infected cells with the virus, because you need enough of cytotoxic T cells and you need to have memories of Th1, which that is the problem with one of the problem with the vaccine. And if they have the vaccine that gives you that balanced immune system where you have enough of memory of Th1, Th2, and Th17, and you have both humoral immunity and cytotoxic immunity, I think we can fight this virus and clear this intracellular viruses, because the only way we can do that is cytotoxic T cells, which is those vaccines, they don't produce enough of it. And so again and again, we find out that lower level of Bifidobacterium is associated with the severity of SARS-CoV. And so Bifidobacterium helps to produce enough of butyric acid and anti-inflammatory to put those inflammation down. So if you don't have enough of this bacteria, you may have enough of, you would have a severe infection of COVID, and you would have overwhelming cytokine storm. But this bacteria will work as an anti-inflammatory, helps to dump the inflammation down, inhibit the cytokines storm that leads to all the sickness, especially the Th17 overinflammation, and all the cytokines that leads to Th17. So probiotics have been hypothesized and tested successfully for improving the SARS-CoV-2 symptoms. So you can introduce and give Bifidobacteria for those patients. And it helps to produce enough of anti-inflammatories, postbiotics, to calm the inflammation. And we thought, so anything that helps to increase the level of beneficial bacteria, like Bifidobacteria, anything that helps increase the population of prebiotics, of the Bifidobacterium, it's a good thing. And what we find is ivermectin works as like a prebiotic, and it helps to feed and increase the population of Bifidobacterium in your gut. And so ivermectin has been shown to be effective in treating SARS-CoV infection. One way is by acting like a prebiotic, feeding this Bifidobacterium and increasing its population in your gut. And then the Bifidobacteria secretes the butyric acid and all the chemicals that helps to suppress the hyperinflammation on the cytokine storm of the COVID. So there's many studies that shows ivermectin helps in SARS-CoV, and one way is by feeding the Bifidobacterium and throw Bifidobacterium, and their postbiotics, the inflammation of the COVID subsided or helps to calm them. But we know other mechanism of COVID, of ivermectin, which is blocking the spike or inhibiting directly the Th17. So those are different mechanisms. So anyway, 80% of studies showing positive effect outcome of ivermectin. Again, ivermectin is not man-made chemical. It's a naturally product made from It's a postbiotic of Streptomyces ivermectin. And we find out the ivermectin, according to the studies, helps almost 60 to 85% improvement in the outcome, including the mortality, the ventilation, the recovery, the clearance. And why? Because of its anti-inflammatory effect and its antiviral effect by blocking the spike protein, and its anti-inflammatory effect directly by inhibiting the Th17, and indirectly by feeding the Bifidobacteria, and Bifidobacteria does the work by secreting butyric acid, and butyric acid is anti-inflammatory. The effectiveness could be particularly strong at high dose and for severe SARS-CoV infection, and must consider that effective dose is very effective by food co-administration. So when you take ivermectin, it's good to take food with it. And it's good to take even a probiotic containing Bifidobacteria as well. And so we need to know what's the mechanism of ivermectin, how it works. Again, we explain it. It works by feeding the Bifidobacterium. The Bifidobacteria mediate the anti-inflammatory effect of the ivermectin, or directly the ivermectin works by inhibiting the virus by blocking the spike protein, or by directly inhibiting the Th17 inflammation. Ivermectin discovery was awarded the Nobel Prize 35 years post-discovery for its game-changing impact in the field of antiparasitic agents. But again, ivermectin is not an antiparasitic only. It is also anti-inflammatory, same like tetracycline. It's an antibiotic and anti-inflammatory, right? So ivermectin is approved by Food Drug Administration for treating parasitic infection, and also approved by Food Drug Administration for treating rosacea, which is inflammation of the skin. And we know the inflammation, what kind of inflammation the rosacea is Th17 inflammation, same like systemic lupus erythematosus. That's why we use hydroxychloroquine for systemic lupus erythematosus. We use ivermectin. It's very effective because it kills the bug and it calms inflammation. So two things, it's antiparasitic plus it's anti-inflammatory. And so again and again, I think most of the doctors, even the people who are promoting ivermectin before, they don't, I never hear from Dr. Corey, and even Dr. Peter McCullough is saying that this bacteria, this ivermectin is produced by bacteria. Because I think if we recognize and know it's coming from the bacteria, it will be more accepted by the mainstream medicine. Because anything that's coming from the nature, most of the time, are less toxic than the man-made, right? And so it's found naturally. Who is the bacteria producing it? Streptomyces ivermectin. The question is that, directed to Dr. Hotan, can you make probiotic out of Streptomyces ivermectin, and that we can generate ivermectin in our gut? We don't have any probiotic have Streptomyces for humans. We have it for the shrimp, for aquaculture, yes, and they use it to kill the parasites. But we can use the Bifidobacterium in a state of Streptomyces, because the ivermectin is produced by Streptomyces. It's feeding the Bifidobacteria, and the Bifidobacteria will produce the postbiotics that will decrease the inflammation. But that's the question: can we add this in the probiotic? I don't know. But what we know, we have Bifidobacteria available, and Dr. Hotan here is a pharmacist, I think, among us. He's selling those probiotic rich with Bifidobacteria. And I think the education is for obesity and for metabolic syndrome, but also, as we learned today, it will help to protect you from the overinflammation of viral infection in general, whether it's flu or COVID, because of the postbiotics product that this bug is producing in your gut. So while the ivermectin mechanism of action is antiparasitic agents are well established, its potential to fighting viral infection, disease, including SARS infection, remain poorly understood. I think it's not any more poorly understood. We know that it helps to block the spike protein, and we know it does help to decrease the inflammation and the cytokine storm. TH17 and put it down, because you cannot really do much with TH17 to kill virus, right? And that's when a virus, that's how they work. They fool the immune system. And normally the flu virus, when you get the flu virus, you will see most of the response is going to be Th1 and cytotoxic T cells. And you will have some Th17, yes, and Th1. They work together with the B cells to produce enough of immunoglobulins, humoral immunity. But the Th17, it's good to fight bacteria, because Th17 inflammation leads to polarization of your white blood cells to neutrophils, and neutrophils kills the bacteria. So it makes your body, those COVID-19, as you being infected with bacteria, it's fooling your system, fooling your immune system. And so you're getting the wrong response. You're getting too much of neutrophils. And neutrophils cannot do anything with viral that's inside the cells. Neutrophils cannot really kill or attack or destroy infected cells with viruses, right? What you need cytotoxic T cells, and you need Th1 immune response. So that's how your immune system can be fooled by the virus and can be moved to the wrong inflammations. And then you need to give the patient things that help to suppress this wrong inflammation, this Th17 overactive, because it's not doing much. It's actually destroying your body. Same thing with cancer. Cancer, you can kill it with Th1 and cytotoxic T cells. But what the cancer does, it fools the immune system, and it secretes chemicals to polarize the immune system away from Th1 and cytotoxic T cells. So you have Th2 and Th17, and you have list of Th1, and the cancer is growing with this kind of inflammation, because neutrophils cannot do much against cancer, nor much of immunoglobulins. You really need to have cytotoxic T cells, and this is how viruses, especially COVID and cancer, how they work in fooling the immune system. And so this bacteria helps to inhibit anything inhibits Th17 will help in managing those infection and inflammation coming from this virus. Even for cancer, you need to give medication that inhibits the Th17 and Th1, so your immune system will start moving to Th1. So Streptomyces species belong to the same phylum as critical important constituents of the gut microbiome and common ingredients of probiotics, Bifidobacterium. So there's synergy between Bifidobacterium and Streptomyces. And Streptomyces produce chemicals that feeds the Bifidobacterium. And we know that the more you have Bifidobacteria in your gut, the more you're protected from the SARS-CoV complications. And so we can say from today that let's go ahead and recommend Bifidobacteria for all the patients, including COVID with cod liver oil during this season of winter, so that we can fight the COVID and even flu. And so we know these two bacteria, they can even replace each other because they have that synergy and they feed each other. And you can replace, if you don't have enough of Streptomyces, you can replace with Bifidobacterium because they may have the same postbiotics, which is mainly butyric acid. So Bifidobacterium is micro-air-tolerant anaerobes that degrade monosaccharides such as glucose and fructose via bifidoshunt or fructose 6-phosphate phosphatidylase pathway and produce more ATP than traditional fermentive pathway. So Bifidobacteria feeds from the glucose and fructose and generate ATP, and those two things that's actually the ivermectin is made from. They are made from sugar, from carbohydrates and sugar that the Bifidobacteria feeds from. And the Bifidobacteria species also symbiotically feed other gut microbiome via their metabolized byproducts. So the Bifidobacteria produce postbiotics that will feed the healthy bacteria in your gut, maybe Streptomyces and others. And very important that what is the postbiotic that Bifidobacteria produce? It's the butyric acid production. And we know that butyric acid helps to decrease the inflammation. So Bifidobacteria, yes, it feeds the good bacteria, giving them the material they need, and also to enhance the the growth of the good bacteria, but also it produces butyric acids. And we know the butyric acids help to decrease inflammation, helps to kill the colon cancer, right? And so there's a relationship, some symbiotic relationship between streptomyces, and you can replace them between the streptomyces and bifidobacterium. So if we cannot find, or if it's impossible for us to create probiotics containing streptomyces, then don't get worried. I mean, don't get upset. You can just use the bifidobacterium because it does the action of streptomyces in the gut. And so increasing bifidobacteria levels serve as an important indicator for human health and may promote anti-inflammatory activities, especially putting down the overactive Th17 inflammation in the gut. We know that obesity and old age and all that are putting us at risk of having complication of COVID. And we know the reason why, because they have low bifidobacteria, one of the reasons. And giving them bifidobacteria would definitely help to, it helps to decrease weight, so you're optimizing the health of the patient, and also it helps to fight the COVID-19 complication infection. And we know that people with low bifidobacterium in their guts, they have the high risk of COVID complications. So any probiotic contain much of bifidobacteria species will be a good thing. And I think it's useful for SARS-CoV-19 infection, both prevention and treatment. So if you want to prevent your patients from suffering from COVID complications, give them bifidobacterium probiotics. And if they have it, then you can also give them bifidobacterium, because the bifidobacterium will produce butyric acid that would work as an anti-inflammatory and decrease the cytokine storm and the bad inflammation. So it boosts and balances the immune system, protecting us against COVID complication infection by its anti-inflammatory properties. And when you are suppressing the Th17 with the butyric acids, you are actually promoting the Tregs. So you will see that the ratio between Th17 and Treg will decrease, and you have more Treg and less Th17 when you have enough of bifidobacterium. And that's what you want, right? You want to polarize the immune system from Th17 to Treg. Treg produce interleukin-10 and helps to decrease the inflammation, the fire down. So you need to decrease that interleukin-6 and tumor necrotic factor and all those inflammatory cytokines, and bifidobacteria does that directly by reacting with those inflammatory cytokines, or indirectly by secreting butyric acid. And so we know that the bifidobacteria suppress the Th17 inflammation and cytokines, but it increases what the Treg cytokines, which are the anti-inflammatory. So we understood that if you do that and you decrease the inflammation, you manage the leaky gut, because leaky gut, when you have overinflammation, when you have too much of Th17 and too much of inflammatory cytokines and too much of neutrophils, it will damage your gut epithelium and cause leaky gut. So if you're able to reduce the pro-inflammatory cytokines, you can restore the intestinal barrier integrity. So it's good to manage leaky gut syndrome, which is one of the problems of patients with obesity, is because of leaky gut and those inflammatory free radicals that's being seeped or leaked into the gut. It will make your fat resistance for lipolysis and beta oxidations, and it will have a hard time to burn those fats. And so leaky gut is one of the reasons of obesity, and managing it helps to get those to make those fat cells more prone for their fat to be burned. In short, bifidobacteria throw interleukin-6 and tumor necrotic factor alpha. It helps to suppress those two cytokines, and if you suppress those two cytokines, directly or indirectly by producing butyric acid, or directly the bifidobacteria itself. It combines with human necrotic factor in the gut and helps you to wash your body from excessive human necrotic factor. And definitely this will balance the immune system, and definitely balancing it by decreasing the excess amount of pro-inflammatory cytokines and increasing the amount of anti-inflammatory cytokines. And this will help to negate the SARS-CoV-19 infection. And so ivermectin treats SARS-CoV infection by decreasing the inflammation, as I said, the bad inflammation, the Th17 overactive inflammation, which really this inflammation does not do anything to the COVID virus. It's neutrophils, and neutrophils cannot really get rid from infected cells with viruses. You need Th1 inflammation for that. And so ivermectin, directly or indirectly, helps to calm down this Th17 inflammation, indirectly through feeding and increasing the bifidobacterium replications and the production of butyric acid. And also by the bacteria themselves, bifidobacteria, it combines directly with tumor necrotic factor and helps you to wash your body from the tumor necrotic factor. So Bifidobacterium inhibit inflammation by binding. So it binds directly. You see, the bacteria binds with tumor necrotic factor, and also by producing the postbiotics, which is butyric acid. And this butyric acid helps to inhibit the Th17 polymerization and decrease the Th17 inflammation, decrease interleukin-6, and the neutrophilic hyperinflammation, and hence the Th reg polarization, interleukin-6 anti-inflammatory effect. But also that ivermectin, it contains monosaccharide, so it's a food, monosaccharide olindrose moiety that could feed the bifidobacterium. So it's a food for bifidobacterium. So it's a prebiotic, right? Prebiotic, either they're feeding the good bacteria or killing the bad bugs. So this is feeding it. They're increasing the replication, increasing the inhibition of tumor necrotic factor, and inhibiting the inflammation. This is just picture shows how the bacteria is reacting with this yellow one, tumor necrotic factor, and helps your gut to wash your body from this inflammatory cytokines, as you see it here. And this shows ivermectin, how it feeds the bacteria, and then the bacteria produce either postbiotics, which is butyric acid, which helps to decrease the inflammation, or themselves, the bacteria itself, would combine with tumor necrotic factor and wash your gut from the excess of tumor necrotic factor, which is the inflammatory cytokines. So the bifidobacteria is a heterotroph, feeds on variety of carbon sources, but most effectively simple sugar, which the ivermectin is. Ivermectin composed of two olindrose monosaccharides moieties along with glycol moiety. So when you give ivermectin, you're feeding bifidobacteria, and I think that's a good thing. If somebody took too much of ivermectin and it got toxic with ivermectin, okay, took too much of it, how we can detoxify the body from ivermectin? I think giving them bifidobacteria may help to clear the body from ivermectin by eating those excess of ivermectin. So I think it's a good idea to detox the body if somebody took toxic dose of ivermectin. Maybe we could give them this bifidobacteria to eat the excess amount of the ivermectin. So those breaking down products include olindrose and monosaccharides that may feed the bifidobacteria to be promoting its growth. My kids coming in. So this same study also demonstrated ivermectin has the ability to bind. See, ivermectin ability to bind to protease. It's not just I mean, the action of ivermectin. It's not just through bifidobacterium, but also it can bind to protease and inhibit the protease of the virus. It can bind with the spike protein, so it has antiviral effect directly, in addition to its prebiotic effect in increasing the bifidobacteria. The ivermectin can inhibit the virus directly by inhibiting the protease enzymes of the virus, and also block the spike protein, and directly inhibit the TH17. So many studies support the protective role of bifidobacterium in SARS-CoV infection, possibly through the immune function of bifidobacteria by its secretion of its butyric acid, or directly the bifidobacteria combined with tumor necrotic factor alpha and wash the gut from wash the patient's gut from these inflammatory cytokines. And so the more bifidobacteria you have, the better, whether preventing or treating the infection of COVID. So anything that disturbs the microbiome and leads to decrease the number of the good bacteria, especially the bifidobacteria, will put you at risk of the cytokine storm and the sickness of the COVID. And so the more you have bifidobacteria, the more you can reduce the inflammation and you can calming the cytokine storm of SARS-CoV infection. And we know that the bifidobacteria, by producing butyric acid, which has anti-inflammatory, or by combining directly with tumor necrotic factor, helps to slow down the inflammation. And again, the mechanism of bifidobacterium, one of it is combining tumor necrotic factor in the gut and wash your body from this inflammatory cytokine, reduce the amount of tumor necrotic factor in the blood, and I think this will help to decrease the damaging effect of this inflammatory cytokines in the lung as well. Right, when you wash your body out from this tumor necrotic factor alpha and from this inflammatory cytokines of the COVID. So we hypothesize that ivermectin mechanism of action as therapeutic for COVID-19 through feeding the bifidobacterium, which inhibit the cytokine infection and tams the cytokine storm. Okay, so any question? You done?
Actually, we have quite a few.
Okay,
We
let's
go,
go through them.
we go all the way to the beginning. Thoughts on Dr. Sabin Hazan's finding persistent damage to the gut microbiome after the COVID vaccine 90 days post-vax, the Bifidobacteria dropped to 0.
They're using ozone?
Excuse me?
He's saying ozone helps or does not help. Is that what he's saying?
Yeah, she's asking your thoughts on Dr. Sabin's findings.
And the findings is using ozone?
Yeah, the microbiome after the COVID vaccine, 90 days post-vax, the bifidobacteria dropped to 0. I don't know if you've heard of that study. She did put the link in the chat, though.
Okay. Yeah, she can come and explain. I mean, if she's there. She left?
I think she's still there.
Yeah, can we hear your voice? I like to hear voices.
Oh yeah, no. She actually was on Del Big Tree. I think it was back in April. It was actually very interesting. So I was kind of curious about it because I mean, essentially, she had said I think it was 90 days post injection, the bifido count was down to 0.
So the bifidobacteria count down to 0 after the vaccine.
Exactly.
Oh, so the vaccine is toxic to the bifidobacteria. Is that what that's what she's saying, right?
Yeah, so I put the link in the chat.
Well, the only the spike protein it does help, or in other words, aggravate the inflammation in our body and decrease the TH17 inflammation, the spike protein, because it inhibits the ACE2. We know the ACE2 is a good thing in our body. It's an antioxidant enzyme, right? Because ACE2, that enzyme that the spike protein is blocking, which generates from the vaccine, it converts the angiotensin 2 to angiotensin 1-7. And angiotensin 1-7, it's an anti-inflammatory and antioxidant. It helps to counteract the angiotensin type 1 receptor signaling. And so that's the anti-inflammatory arm that the spike protein is blocking. And so if your immune system is imbalanced by the vaccine, as we learned from even Dr. Patel, you don't have, you will have a problem in keeping up your gut microbiome healthy, because this imbalance of immune will kill the good bugs, including the Bifidobacterium. So the immune system needs to be balanced. You don't want to give in your body things that imbalance the immune system, leading to damage your microbiome gut. That may be one of the explanations. But how we can counteract that is to give Bifidobacterium as a probiotic. And I think that would help to possibly negate and put down the Th17 inflammation, which is aggravated by the spike protein of the vaccine.
Okay,
So that's maybe the answer is just how you can help those people with vaccine injury and their drop in or their abnormal gut microbiome as a result, is to balance the gut microbiome giving probiotics. Because if you give ivermectin and you don't have enough of Bifidobacterium, it's not going to help here. So I think you need to give them Bifidobacterium, and if you want to give ivermectin to feed this Bifidobacterium, that's fine, it's a prebiotic. But if you give the ivermectin and you have zero Bifidobacterium, then you don't get that the function of the ivermectin. So I would recommend giving Bifidobacterium, and if you need to give ivermectin, that's fine as a prebiotic. Any other questions?
Oh yeah, there's plenty. And a follow-up to that, she also had mentioned that our missing microbes, short-term antibiotic courses have long-term consequences. Is Bifidobacterium more susceptible than other gut microbes to attacks from antibiotics, vaccines, Western diet, glyphosate, etc.?
Yeah, and that explains why we have the obesity. 60% of the Americans are obese. And I think, and I'm one of them, I think it's because of the bad foods. If you want to eat good food, I don't know if Dr. Patel is here, because I went to her house and she, with her husband, they have a very great hospitality from them. And do you know Dr. Patel? She, in her food, there is no plastic. All the utensils are either glass or metal, but there's no plastic. So this is one of the things. So yeah, I think the chemicals that we are taking, whether through the plastic environment that we live inside it, because everything around us is plastic, and especially plastic utensils, you can get rid from it. And I think Dr. Patel will tell me yes, because she's one of a very good. She's not just preaching detox, but actually she is applying it in her lifestyle. The more you go back to original food and organic food and natural food, the better, because all those chemicals, including antibiotics, and including the animals that we are eating, they're fed with antibiotics. So they all just can disturb your microbiome. And if you disturb your microbiome, then you don't have enough anti-inflammatory postbiotics that helps to balance your immune system. And we end up with all this chronic diseases, aggravating diabetic and causing metabolic syndrome. Yeah, I think all this chemicals and junks that we're eating it's part of the reason why we have high rate of metabolic syndrome. And metabolic syndrome include diabetic, hypertension, high cholesterol, obesity, and we need to come up with a program for a metabolic syndrome and clinics for metabolic syndrome. I don't like clinics calling themselves weight loss. I like clinics calling themselves managing metabolic syndrome, so they can manage the whole pieces of not just the weight loss, but the whole optimizing the whole system to restore the homeostasis and restore the blood pressure and your cholesterol level or your and of course the weight and all that back to normal.
Okay, Nicholas asked, what is your favorite brand of probiotic for the Bifidobacterium?
I have here a pharmacist, the doctor here. He is selling probiotic. His Hotan, I think. Hotan, are you there?
Yeah, he mentioned it and he put it in there, and he also,
Yeah, just go with Hotan. Hotan is, I'm helping him also to create probiotic specific for different diseases.
okay.
So I think he will be a good. I mean, I like companies who has doctors, right, doing the research and development and interacting with us, like Mike Beamer and the compounding pharmacy. I don't like to work with somebody who is not a doctor and selling medical products. You will not get enough. You will not learn from his product, nor you can help to modify and upgrade it and change it and make it better. So I like doctors to be in charge of research and developments of a variety of products, and have doctors connecting with those pharmacies and direct them and help them to develop new products. And that's what Hotan can do with you guys. He can work with you and develop even formulation that you think is good for your patients. I'm thinking about putting a formulation for ovarian cyst syndrome. I think that's one of pandemic that we have 20% of the females and women, they have this polycystic ovarian syndrome. And part of it is because of the nutrition also. And we need to create some supplement for that. So I'm trying to develop that with Hotan.
Well,
Any other questions?
That's great info, Dr. Hussain. I have done quite a lot of work with several of the nutraceutical companies that use licensed strains. And the thing that has really changed my whole approach on working with the microbiome is the data, research, evidence that's been produced by microbiome labs in their spore-based approach to utilizing bacteria that promote short-chain fatty acid production and appropriate support for the 25 keystone species. So there's a number of different ways that you can approach success with using probiotics, but the evidence supports the use of spore-based licensed strains, in my opinion, the best.
Thank you.
Yeah, the spore as they are, because if you take the bacteria without, it get broken down by the stomach.
Right.
As
There's no, they pass through acidic environments without any degradation.
Right, that's the reason
That's one
spores
of the,
better than bacteria.
yeah.
Yes, I agree with you 100%. Anybody, yeah, that's the reason. Talking to doctors, you can get a valid product and make sense versus talking to somebody who's going to sell the product, regardless of the science.
Yeah, you just want to make sure that they're using licensed strains so that you actually know what you're comparing.
Right, right.
We only have one more question.
Okay, any other questions?
One more. What do you think of bifidogenic acacia?
Everybody's happy?
Can you hear me?
So I think the
Can you hear me? Did I lose everybody?
So I wish that was the case.
Okay,
you
I'm
know.
back. Can you hear me?
Yes, go ahead. Any questions?
Let's see. Yeah, it looks like, let me get the chat back open. Um,
So we have 22 people here. Do you have any questions? You can come up to the mic. Let's hear your voice. The reason we have those meetings on week is more of social gathering. It's not really, and that's the reason we come here. It's, the same think tank and talking. So I'd like to hear voice more than chat and writing. And
amen. I agree.
yeah, so if you can come up and listen to her, because we want to socialize here, okay? We want to hear voice and reaction and stories, and we don't like to be like others where you have this kind of one way and and information one way, and now you don't talk to the interrupting me or questioning me. That's what I do in my room. That's what I like in Dr. Williams' room and even Dr. Farsan's room, is that discussion back and forth, so we can enjoy the contribution, and then we can learn from you. I'm not here just to give. I want to take as well. So Dr. Patel, I'm teasing her to come on the mic so we can learn from her. And so that we can all contribute in solving a problem. So anybody has a question? Anybody has statement? Concern?
I just want to make sure that we all understand that Bifidobacteria is just not one species. There are about 6 species of that. And I don't know which Bifidobacterium you are talking about. So it may be Dr. Hassan can talk.
Yeah, Dr. Hutan, are you there? Tell us about what strain you think, because you're more pharmacist than I. I don't know if he's here. Or somebody who's pharmacist here. I think Bifidobacterium bifida, I think it's the one that I know. Anybody here? No. Yeah, I think it's the Bifidobacterium bifida. It's the same name. It's same genera, I think. If I'm not correct me if I'm wrong.
So one more question, if Maura doesn't want to come on live. She asked, what do you think of Bifidogenic acacia dietary fiber? Public TV did a series on it years ago, and there are many studies on its beneficial support of Bifido. I haven't heard of it.
Acacia dietary fiber.
Yeah, Bifidogenic.
Is that a food for the Bifidobacteria?
I wouldn't know.
Yeah, it's a food. It's like a fiber. I think it's like a prebiotic. I suppose that would be the best description. It's a polysaccharide, but I know they did a big thing on it years ago now on public television, and it was all about just a very good support for the Bifido.
Right. Yeah, I mean, this is prebiotic. Anything that feeds the gut bacteria, the good ones are a good thing to be added in the regimen.
And there are papers on that. There are a lot.
Yeah, I think it's a good thing.
Doesn't it produce the short chain fatty acids? Maura?
What is that?
I think, we use acacia in our office, and we use it for constipation, but at the same time, if I understand it correctly, that it is the fiber, and fiber gets digested, it provides some short chain fatty acids, and short chain fatty acids are essential for the growth of the bacteria in the gut. So that may be how it may be beneficial.
Right. Anything that feeds your healthy bacteria and kills your bad bugs, we call prebiotic. It's a good thing. Yeah, and as long as it feeds it, and then whatever bacteria is producing after that, we call postbiotic. And
I have one question that said there was one reference someone provided that COVID vaccine kills the Bifidobacteria for 90 days and almost 0% is there. So during this phase, if we are giving the Bifidobacteria externally, wouldn't that die too? If it is the effect of the vaccine. And it's not just the pre-existing bacteria. So, I mean, we have to think about that. Okay, I'm going to provide, but yeah, I'm going to provide. But if it killed already the existing, which is already there established, and if it kills that, then if we provide externally, you think it's going to also survive?
Well, you provide externally, and you're trying to fight it. So those bacteria will produce the postbiotics and helps to put down the inflammation, the overactive TH17. I think the vaccine the reason it's killing this bacteria possibly because of the imbalancing the immune system, and imbalancing the immune system will lead to the bad bugs to grow, and the bad bacteria will kill the good bacteria. So anything that helps to add the fight in the good side, I think it helps to balance the whole thing. So that's how I see it. You got my point? It's just it's like a fight, and you have the enemy, imbalanced immune system, and you have the bad microbiomes. Both of them are reducing the good bacteria from growing.
So it may be a good idea to then give it with the ivermectin, Bifidobacteria.
Yeah, to feed the ivermectin, yes. And then ivermectin possibly will neutralize the spike protein of the vaccine along with McCarran Blvd. Yeah, you need to provide things that will antagonize.
But just providing the Bifidobacteria by itself may not serve the purpose.
I think
adding it with some other molecules.
Yes, I agree with you. Adding McCarran Blvd, adding cod liver oil, adding ivermectin, all of this may help to turn the balance back to normal, and kill the effects of the vaccine, which is the spike protein. Anything that neutralizes spike protein is a good thing, because the pathogenic effect of the vaccine is the spike protein inhibiting the ACE2, and then that leads to the imbalance of the immune system. And then imbalanced immune system leads to overgrowth of the bad bugs, and the overgrowth of the bad bugs inhibit the good bugs, and patient will have dysbiosis.
So
and
what is your opinion about the COVID vaccine in a patient with psoriasis?
Again, vaccine, this COVID or spike protein, it makes the immune system to be moved to TH17 inflammation, and people with any TH17 inflammation, like they have psoriasis or they have systemic lupus, it get worse because you're adding more gas to the fire. So the spike polarized the immune system to TH17. And the patient already have TH17 inflammation from the sickness that he has. So you are adding the gas on the fire here. And so you're giving things that helps to calm the TH17 inflammation. And whether Bifidobacterium, ivermectin, McCarran Blvd, NAC, things that we recommend, vitamin D or cod liver oil, all of this helps to put that TH7 inflammation down. And then you have to have something that neutralizes spike protein. And I think McCarran Blvd, ivermectin, things that combine with spike protein, NAC, all of this would help to restore the homeostasis to the body. The problem with mRNA, I'm afraid of those RNAs. They're integrated and reverse into DNA, and then you have the permanent expression of the spike protein. That's the problem. Then you need to continue taking all this things, cod liver oil and all that as a continuation, because it's just be introduced into DNA. That's if the case that there's reverse RNA to DNA.
So if you are giving the ivermectin with Bifidobacteria with the vaccination protocol, would you give that for what period of time?
Yeah, it depends on, now the question is that whether those spike proteins are those messenger RNAs that produce them, are they short-lived, or they integrated and become DNA, and they are permanently you're producing spike protein. I don't see the reason of giving ivermectin all the way, because we have other thing that's more natural that can block the spike. NAC and McCarran Blvd, those patients need to be taking it forever. If those RNA reverse the DNA and you have a permanent expression of the spike. The question is that
If we
it's
kill
all about
the
the spike.
spike protein, then where the protection is going to come from? If it does not enter the nucleus, does not replicate, does not.
Yeah, so that's, we don't know.
I mean, we have to, they want that for their protection. Now, we don't want their disease to flare up, but they say we don't want to die from COVID, we want protection. And I mean, you have to follow what the patient wishes are and what the patient wants, is despite knowing that what are the side effects versus the benefits. And if you are going to give them, I mean, would you give on day one, or you would wait for a few days, or how would you? Because there has to be a vaccine protocol.
The problem is the cost. If you tell them, you're going to take all this, people cannot afford it. But giving NAC is the cheapest one, right? NAC and cod liver oil. If you just give NAC and cod liver oil, and you start, let's say you start with McCarran Blvd, and you tell them, okay, well, 3 months of McCarran Blvd, and that will be enough. And then we just continue, but you have to take NAC and cod liver oil maybe forever. If you find out that spike protein is not, it's still in your blood. And that would be good if we can test the spike protein, because that gives us even more better data to know whether we need to strictly tell the patient to have it or not, and whether the RNA is being integrated in the DNA or not, is to measure the spike protein. Now the question is to you, Dr. Patel. Do you know any test that measure the spike protein? Any lab that measures spike protein?
I haven't come across who measures the spike protein. There are other integrative physicians around here. So if they know someone that
anybody now, that will be give us some clue.
We want the regular lab to do it. Patients can't afford all this specialty lab, but they have to pay out of their pocket.
Yeah, at least once a year, that would be good. And we don't want to order it all the time. At least once in there, 2 years, to know whether there is spike or not.
But clinically, if they are doing okay, we know they are able to hopefully be beating this more side effects.
Yeah, but let's say you give them those regimen, okay, and patients stop taking the supplements, and then you measure the spike protein after 3 months or 4 months, and it's high. Right, you got my point. Or you measure spike protein and there's no spike protein. The one that goes high, you really need to recommend them to.
Usually, I think it is the ongoing cytokine macrophage sensitization and ongoing cytokine release, because I checked patient and she had all other tests except the IgG2 was deficient, and all other lymphocytometry, that lymphocyte flow cytometry was normal, except that she had a lot of elevated cytokines, including interferon gamma, IL-13 and IL-6 and TNF alpha. So in presence of those cytokines, then she went and had a COVID vaccination. And then we stopped her Otezla, and she had psoriasis, and she had already arthropathy in her one knee. And the main reason we had to, because she was super sick and we did not know what was playing the role. So we said, well, we are going to put Otezla on the side. And while on the day she went off Otezla, she got the cytokine done. So we know that those cytokines were there when she was on Otezla. So I mean, there's a big question and so many side effects. So in presence of Otezla, if she had all these cytokines elevated, then and then she goes and have a COVID vaccination. What else would you expect? I mean, I did put her on KPV, I did put her on probiotics, I did put her on methylene blue and etc. But the point is, if she has a flare-up of her psoriasis, psoriatic arthritis, I have a big problem, then where would I go?
So you give her all that. She's still on Otezla, right?
Huh? I'm sorry. No. I had to stop her Otezla, and she was feeling better, except that the arthritis have flared up, which she had it before. It's not like but she had like her pain was like 2 or 3 out of 10. It's now 4 to 5 out of 10. So I mean, as the time goes on, I don't know whether it will get worse or
There is a drug that we are trying to come up with, the DMF, the dimethyl fumarate. It's been approved.
I was thinking about that and amloxanase. So I kept that in a back pocket, but I was just wondering. And whether oxytocin nasal spray would help her or not. Because we have to look for, we can just say take this and take that, but these are young people. Sometimes they are single mothers, they are working, they are doing optimally, but then ongoing stress of spending money is a lot.
Well, they have genetic problems. It's just hard to stop that. They are going against the flow of their abnormal genes, and we're not really fixing the genes itself. So that means it will cost money for patients who has genetic errors in their psoriasis. There are some genetic errors there, so they have to take something for forever to keep the balance and keep kind of swimming against the flow. And she needs to just find something that's more biologically friendly. Anything that's not biologically friendly with long term, it's going to have side effects, and it's not.
That's like you check it. I mean, they can get lymphoma, they can get other cancers and all that.
So this is one you cannot really give for forever. So we'll look at something like amloxanox. Amloxanox works the same active mechanism of action of it's a phosphodiesterase inhibitor. Amloxanox is phosphodiesterase inhibitor, but maybe without that much of side effects. So I'll give amloxanox, and I will give if that does not help with KPV, then I will move to DMF. And with NAC, with DMF is more biologically friendly than Otezla. And if that, I think that will stop, because that's FDA approved for psoriasis. It's for multiple sclerosis and psoriasis. That's what I would do. I will choose drugs that's
Mike doesn't have that yet. Mike doesn't have that.
What is that? Mike is
I checked with him. He doesn't have it.
No, he's going to work on having it. So they're going to have it soon. I think they got the source, and they're going to make it. And what's going to make it going to be better than the mainstream ones, because they're going to add NAC to it, N-acetylcysteine, that will prevent any liver problems for the use of it for long term. But that's the most biologically friendly that I know, and it's effective for your case. It's DMF. Amloxanox, if the amloxanox did not work, amloxanox is more biologically friendly. It's less, it's like a candy. I see amloxanox, because there's no reported any toxicity from it, according to all the studies that I read, except some allergic reaction, which happen to any drug that you take. So amloxanox KBV does not work. DMF, NAC. Along with if you methylene blue and oxytocin and all that things as a base, cod liver oil and all this stuff, that definitely cod liver oil is very important for psoriasis, because vitamin D it inhibits I mean, it's part of the management of psoriasis is giving analogs of vitamin D.
Someone asked the question that what is Otezla? Otezla is used for psoriasis and psoriatic arthritis, and it is the phosphodiesterase 4 inhibitor. And it works by inhibiting the action of PDE4 that plays a role in inflammation. So, and isn't that the DMF works the same way?
Yes, and amloxanax works the same way, but without that much of side effects.
Yeah, right.
yes.
And again, Otezla can be given orally, and so is the DMF can. But I'm not too sure that many of the attendees, they know about dimethyl fumarate.
Well, Joseph has a good lecture,
Yes.
and I will introduce a good lecture, and you can introduce one. It's something that's actually Dr. Joseph is the one who brought it on the table, and I'm pushing it because anything that's is biologically friendly because it's dimethyl fumarate. Fumarate is part of the Krebs cycle, and we find out that intermediates of the Krebs cycle, they are anti-inflammatory. The intermediates, the fumarate itself. The methyl part can turn into methanol, and methanol is a little bit toxic, yes, but we can negate that by giving NAC. But it happened that this drug is made with methanol. Maybe to increase the absorption. I don't know why they add, but that's what we have available, and it works very well. And it's for multiple sclerosis and for psoriasis. I think they're approved in Germany for psoriasis and for multiple sclerosis in the United States. But the intermediate of Krebs cycle that's why keto diet is good. Anything that activates the mitochondria and Krebs cycle and give you all the intermediates, they are good for the inflammation. So anything that cuts that Krebs cycle, like glycolysis, that's why sugar is not good, because then you don't get the benefit of the Krebs cycle.
Here's your question on the probiotics. Has anyone ever measured, we assume we're giving this and that. I heard a study, they actually measured with colonoscopies, and none of the bacteria they were ever giving really colonized anything. I mean, we give, one probiotic or another. Has anyone measured that they're really getting where they're supposed to be?
Yeah, you mean, I think the doctors had talked about it. They say those bacteria, if you take them as a bacteria, they will be degraded in the stomach acid before even getting into the gut. And so that's the reason that needs to be in a spore form, so that they can pass the acidic part of the gut of the stomach and populate there. Well, that's the question that needs to be answered, I think, is for example, we have pharmacists here, two of them, right? Hutan is not here, but he's supposed to be here. And then we have another pharmacist.
All right, well, no, it was
Any pharmacist here? Pharmacist? Yeah. Yeah, but I think the spore form will be better. Yeah, what let's try it. Let's see if clinically, as a doctor, we sometimes we do think that's fine.
Doesn't anyone actually measure it? They're selling a product. You think, say, we prove this really shows up in the intestine, in the lower intestine. It said, the study I heard, no matter what you did, they didn't grow in where they wanted to. It just doesn't do it. I mean, does anyone, why can't they show it? Why doesn't anyone do the study instead of say, give this and theoretically it'll do that? We talk about proof mechanisms and proof. Well, there's no proof of any of
Yeah,
these
so that's where
probiotics.
when you come to those pharmacists and doctors that they're selling it, you just have to tell them, show me the proof that that the Bifidobacterium bifidum, I think the strain that Dr. Patel is talking about is Bifidobacterium bifidum. Show me how it bypassed the gastric stomach and whether it's growing inside the intestine? Do you have proof for that? Do you have before and after, like, doing stool culture?
Right,
Or
right.
taking the stool and check the microbiome there before and after taking and see what change happened.
Right. Actually, another
So-
question that came up, a friend of my son's, a very brilliant young man, he got the COVID vaccine, never had COVID, and he felt sick. And he's a wealthy man. Quest measured, what was going on, and he had like about 10 spikes in his blood per whatever the measurement is. And okay, then by month 3, he was getting sicker, and they had a couple of hundred spikes. By month 6, he had like 800,000 spikes in whatever the measure that they do, and very sick, and they have to. So his body is making these spikes, and he's very sick. Quest does measure it, by the way, can measure it. So they have to now tamp down his immune system to stop making these spikes. And I know Dr. Patel mentioned a case. You couldn't measure the spikes, but you see the surroundings of the spike. You see all the TNF alpha and all the cytokines are very high, probably responding to higher numbers of spikes going up and up. I mean, he had like 800,000 spikes per whatever the measure is, and he's very sick. And I wonder how often this happens, and if there's a way to get Quest to facilitate the test. But they're doing the test because he could afford it. But he's very sick and it's actual spikes in his blood. It's not cytokines. Well, maybe cytokines. I don't know his full case, but I know spikes is a big part of it.
How do they measure that he has lots of spikes? So they have a test to measure the spikes, right?
Yeah, they requested it. Yeah, they measure it per whatever. Let's say that's whatever it is. But
Yeah, they
the
can measure
numbers
from the stool or from the blood or from.
No, it's from his blood. This was from his blood.
They can also get it from the stool as well, because that when you have a pandemic in certain area, they go to the sewage, and they can detect spike protein there, or
right,
spike
but
MRI.
I mean, if your patient's getting sicker and you see the spike count is going up and up and up.
Right, there is some reverse transcriptase. That means some of those messenger RNA got into either the human cells DNA integrate or gut bacteria DNA. I don't know. There's some integration and permanent production there if the spike is going up. Because normally, if this RNA are biodegradable, the spike has to go down, right? Not up. But if it goes up with time, that's mean it's being reverse transcriptase like HIV, and the host is now producing it, and that's a disaster, because those we call them spikopathy, definitely to change the immune system, because it blocks the ACE2, and ACE2 it's an anti-inflammatory antioxidant arm of the renin-angiotensin system, and it leads to polarization of the immune system to Th17. And then anything that's in his body, and any underlying inflammation, if he has diabetes or he has hypertension or he has any autoimmune or rheumatoid arthritis, it will flare it up. It's like putting gas on fire. And so how you can treat this, I mean, you need to give them McCarran Blvd, NAC, and things that blocks the spike. But whether this will clear and take care of the integrated DNA, that's something I don't know. We don't have any medication that will pull the DNA out of the host and stop production.
Right, but how many people are having high spike counts? Because you can't measure it. You just measure, whatever we are measuring, but the cytokines. But how many are
No. You don't come up with cytokines and measuring and say the spike. They have to measure the spike itself.
Well, they did in this case, but I don't know of any other cases where they actually.
Because you don't know whether those cytokines come from the spike or come from other conditions, like maybe he has already genetic problems like psoriasis.
No, it was a healthy young man, brilliant, healthy young man.
Yeah, so this guy, if they've proven that spike is high, then he needs to be managed with the spikopathy, and that's a condition, and we have to give medication that neutralizes the spike. But I don't think we have anything that will get rid from the expression of the DNA of the host of the spike protein. I mean,
Right.
he'd be taking medication forever.
Right, that's
And
a,
the strain, I think Dr. Mattel is talking about, is the Bifidobacterium bifidum. That's the species that I know. It's Bifidobacterium bifidum. Yeah, it would be good if we can come up with stool analysis. Now, you talking about the microbiome. There is already LabQuest to tell you about the varieties of bacteria in the stool. So what you do, if you're a clinician, you want to know this probiotic works or not, you can do it on yourself. You send a sample of your stool that you have into this lab, and they tell you about all your microbiome in your gut, right? All the numbers, varieties, and all that. And then you take the microbiome for a course of 3 months or 1 month, and then you send your stool and see if there's any change in the microbiome.
No, it sounds simple, but do any of these companies actually have the proof of this?
Yes.
They do?
When you reach out to Hutan, or there's a pharmacist was here, I forgot his name, and he's selling you something, tell him, can you show me patients that has been taking probiotic before and after their stool analysis? That's it.
Yeah, that's simple. I haven't seen it. Have you?
That's all you need to ask before you buy the good thing is that when you work with doctor works in the company, he will get that studies to get that results, because that's what he wants to do.
Right.
So all it takes is you as a doctor to ask those hard questions to those people who are selling you the probiotics, and make sure that they have the study showing before and after.
Well, what did Dr. Hutan say?
I don't know. He's not here.
Okay.
I mean, let me see if Dr. Hotan is here. I can reach out to him and call him.
No. Okay. Oh, just curious. Okay. Thanks.
Yeah,
Enjoy.
I thought anybody who's here, pharmacist or somebody who's selling supplements or anything, can come up, because I don't know. More or less, he wants to
No,
work. Yeah.
can I just give it's anecdotal, and it's like way back in the 80s, late 80s, and you were just beginning to see AIDS, and I there was one person I looked after, and the worst case of cryptosporidium, he was literally putting out liter upon liter upon liter of stool. So they didn't know what to do. They tried everything, but they actually went in and gave him colostrum, so raw colostrum from a cow that had just given birth. And honestly, like, I mean, it reversed it within 24 hours. I've never seen anything like it. And I've never seen anything like it since. But, you know, they didn't know what to do. It's one story, it's anecdotal. But, you know, it's something that I saw that stayed with me. So I don't know what you guys think about that.
Did the colostrum come from New Zealand?
No, it was actually, I don't know where it came from. It was New England. Someplace in New England.
I know there's been magic with the good stuff, and a lot of the good stuff came from Australia or New Zealand.
Yeah, this chap was literally on death's door, so I don't know that they would have waited for it to come from there, but I think, you know, I'm not sure where it came from. That's a good question, though.
They've just been dealing with it for a long time.
Has anybody in here heard about nicotine treatment with nicotine patches? There are some people that are having good results. Dr. Artist Dr. Ely, Dr. Group, and Dr. Schmidt put on a 2.5-day event. And long story short, they believe they're figuring out what's going on. And this is Dr. Artis was the one with Stu Peter who talked about the cobra venom. And so Jonathan Otto got with Dr. Ely and said, hey, you really need to look into this. It's not woo-woo like what you think it is. And Dr. Ely's like, no way, no way. And Otto stayed on him, and he finally got so upset. He's like, okay, I'll prove Dr. Artis wrong. And so Dr. Ely got his research team to start looking into this. And lo and behold, all the vaccine research going back, starting in the 50s, maturing in the late 60s, definitely developing in the early 70s with cobra vaccines or cobra poisons, toxins, and snail toxins, and all sorts of other toxins. And at the same time, they have what's known as antagonists, because they're developing these toxins to work with their vaccines. And they've been doing it for a long time. So Dr. Ely was like, oh my God, there's something to what he's saying. And it looks like nicotine blocks the nicotinic receptors and helps to somehow lower the spike protein. And according to them, in conjunction with bee pollen and some of the other things, of quercetin and nicotinamide and some other things they're using, they're having great results. And what I had heard is Dr. Artis recommended 4 to 6 milligrams a day. And other people that were in the chat said they're using a little over 2 milligrams per day. So they take a 7 milligram patch and they cut it into 3, and then they put 1 on. And that with bee pollen. And then they also were highly, highly recommending urine therapy. I kid you not, somehow that's working very well, and they're having great results. If I was in that young man's position, and I've actually been in some positions where I was dying before you'll try anything, I think I'd look into Dr. Artis, Dr. Ely, and Dr. Group. He's pretty well known. He's the one that brought in the urine therapy, and it's just something to look into. And I'm doing my best to study it and follow it. And I've got the slides. We don't have the videos yet. And as soon as I get that, I'll try to pass out what I can, and maybe even try to get a little Zoom for you guys and give you an idea of what I think is happening.
Let me explain to that. COVID virus spike protein, in addition, it binds with ACE2 and inhibit the anti-inflammatory arm and antioxidant arm of renin-angiotensin system. So it's hijacking your system, right? And it inhibits the anti-inflammatory and antioxidant arm, allowing the inflammatory arm and the pro-oxidant arm to be overactive. And that leads to polarization of the Th17 and overinflammation and interleukin-6 overproduction. But also, the spike protein also combines with a nicotine receptor and blocks the nicotine receptors. And so you block the nicotine receptor, what happened, you inhibit the vagus nerve activities. And we know the autonomic nervous system, there's 2 arms of it. There's the vagus, the parasympathetic, and the sympathetic. The parasympathetic arm is anti-inflammatory, antioxidant arm, and the sympathetic is inflammatory arm, and it's a pro-oxidant arm of the autonomic nervous system. And so if you block the nicotine receptor, you're blocking the anti-inflammatory arm, and you're causing more inflammation. And so nicotine helps to block the combining of the ACE of the spike to the nicotine, and prevent the inhibition of the parasympathetic activities. And that is part of the management that you need when you are infected with COVID virus, is to give them nicotine to prevent the blockage of the parasympathetic activities and the anti-inflammatory activities of parasympathetic. So that's one. The other thing is that about the snake poisons, you have to know that we extract medicine from the snake venom. The captopril, you know, captopril, for hypertension, this captopril, anapril, eosinopril, lisinopril, all those prils. This comes from the snake venom. So the antihypertensive drug is coming from snake venom. They extract it from snake venom, and that's why in pharmacy you have the sign of the snake venom, because you can extract medication, but also you can extract poison. And what they did, because the captopril inhibit the ACE enzyme, right? They, that's what you need. You need to manage hypertension, inhibit the conversion of angiotensin 1 to angiotensin 2, because angiotensin 2 is causing the high blood pressure, right? Stimulate aldosterone and causing vasoconstriction. So you want to block the angiotensin production. So the ACE one is being inhibited by captopril, which is a drug come from the snake venom. Well, they also designed same thing like captopril, the spike protein, the S protein, but not inhibiting the ACE1, inhibiting the ACE2, which converts the angiotensin 2 to angiotensin 1,7. And angiotensin 1,7 is a vasodilator and anti-inflammatory. So the whole thing about the engineering of the spike protein came from the playing with the snake venom, and you can extract peptides that good to inhibit the ACE1 and give you that antihypertensive medication, captopril, or you can inhibit the conversion of angiotensin 2 to angiotensin 1,7, which is the anti-inflammatory vasodilator, by inhibiting the ACE2. And that's the whole engineering of this lab virus. And yes, coming from the snake venom and relationship with the snake in the lab and extracting poison and extracting, and definitely this has to do with biological war. You can extract and then put in the virus, those poison, and unleash them and kill the people with those poison. And the virus is the best vector to mass for the biological war. So that's the reason, you know, they come up with biological warfare. And if you want to fight, let's say America decide to fight China, what they would do, they create a virus that is poison, and they vaccinate your own people. Let's say Fauci and all the Americans say, okay, everybody has to take the vaccine. Why? Because they want to unleash their toxic virus to kill everybody except the people who are vaccinated. And that's what they do. I think they did it before when Americans, they come with the Indian Americans and they unleash the bug, bacteria, whatever. It's a way, it's a warfare that you can use it to kill and fight by vaccinating your own people and prepare them, and then unleash that virus, and that virus will kill the people that are unvaccinated. And I think that's the whole idea about COVID lab and biological war, is to create a virus where you have the vaccine, they already have the vaccine, and to vaccinate your own people and unleash the virus to kill the people that are unvaccinated. So it's part of military strategy of biological warfare. And if you do that, it's the most cheapest way, easy way than throwing a nuclear bomb that will destroy a building and poison with nuclear waste. You don't want that. You want to keep the building and keep everything and just kill the other side of the enemy so you can do this technique.
Boom. You got anything to add to that, John?
Oh God, let's get into. I tell you what, if you have a directed energy weapon, you don't have to deal with the bugs.
Amen.
Just spray that beam out and don't hit your own guys, and don't put yourself in the middle of the target area. So that's why the biological weapons don't work too well, because most of the time the vaccine doesn't work anyway. So it's a nice idea, and the Nazis were working on it in the 30s, right? And we still don't have it down to a science yet. We've worked on it nonstop for 70 years. Those ticks
Yeah,
are amazing,
it's not necessarily going to work like what they did with COVID vaccine.
right? That's
Yes, it's not how you got your own people are sick from the vaccine
right.
itself.
It's not working. They've been working on the tick and the tick viruses now for at least 70 years. And that's been nonstop. And those little bugs will take whatever you feed them, whatever virus you put in them, and they will transmute it into something else that you've never heard of before. And the consequences are very strange. And at least we know that. So maybe they'll get it down to a science, but they haven't yet.
Yeah, that's what they're hoping. I mean, they failed in COVID and they will try to make something better. I think if they create a vaccine that's not toxic like the one that they have, it may work, but
Yeah.
they did not
do you know
succeed
what-
in it.
Do you know what the first bioweapon was? That was in like 1300 AD, Genghis Khan throwing bubonic plague dead people across the walls. And that's what led the bubonic plague into Europe in those days. And it killed whatever, a third to half the population. But we've been playing with biowarfare forever, and it's a tricky thing.
Thank you. Amen. Okay, I think with that, anybody else have any more questions? Well, actually, there was one more question in the chat about what was the name of the spike test. And I had heard about D-dimer is a test that can test for, I don't know if it tests for the spike or if it tests for the cytokine.
No, the D-dimer is for the clotting factors. The spike protein test, and the reason they did not really, a big pharma did not encourage of doing it, I think there's some sort of politics fighting lab to make spike protein lab test, because that will expose the vaccine thing. I think there's some reason why we don't have tests for spike protein, because then that will make an evidence against the vaccine. What do you think, John? Is that the reason why we don't have spike protein tests?
I have no idea. But
I'm just assuming.
I don't know.
Dr. Dale, it looked like you had something to say.
Well, I just wanted to clarify something, because, the Bifidobacterium doesn't really make the butyric acid. What happens, Dr. Patel started to say something about that. In the distal colon, Bifidobacteria, as well as other friendly bacteria, actually ferment dietary fiber. And they produce 3 short chain fatty acids, one of which is acetic acid, one is propionic acid, and one is butyric acid. The importance of the butyric acid is that it actually it feeds the brain in a sense. It helps the functioning of the brain. When you have severe gut dysbiosis, you not only get fat and get sugary and so on, you also get depression. You have a higher risk of Alzheimer's disease. You have a very high risk of Parkinson's disease with gut dysbiosis, and it's because of the lack of butyric acid, which is a short chain fatty acid, which is indirectly produced by Bifidobacterium. And that was all I had to say. I'm a little OCD about those things.
Sounds important.
Well, I think it is if it's your body.
Amen. Okay, and with that, does anybody else have anything to add?
Thank you very much for having me, and good night, everybody.
Great class, Dr. Halasa. Thank you very much.
Bye-bye.
Thank you. Good night.
Thank you. Good night.
Night, everybody.
Nice.